Hi guys, my name is Sanjay Gupta. I'm a cardiologist in New York, and today I wanted to talk to you about a fast heartbeat and the causes for a fast heartbeat, why it happens, what to do about it. Okay, the first thing to say is that now that we have these Fitbits and apps, people have become a lot more aware of their heartbeat, and it's not uncommon for me to come across patients who come to see me and say, well, look, I was on the treadmill and I noticed my heartbeat was going really fast, and I'm very worried about it because could it mean that I'm going to have a heart attack? Is there a problem with my heart? So I thought I'd do a video on this just to try and alleviate some anxiety that there may be if you ever experience a fast heartbeat. The first thing to say is you have to understand what is the normal heartbeat. The normal heartbeat, the range, the normal heartbeat sort of falls within a range. Okay, normal heartbeats range between 60 to 100 beats per minute. If you are a fit person, your heart rate will in general be lower. And if you are very young, in general, your heart rate is higher. What is an excessively slow heartbeat, or there is no right heartbeat. There's no right rate for the heart, okay, but it should generally be between 60 and 100 beats per minute. The next thing to ask yourself is, how high should my heart be able to go? What is normal? How high can it go? And in general, that is calculated by using a formula, and the formula is 220 minus your age. So so if you're 20 years old, then it's not unreasonable for your heart to go up to 200 beats per minute. But that's how we calculate the maximum predicted heart rate. Now, the first thing to understand is that the heart rate can go up for two reasons. Either because the heart is doing what something else is telling it to do, or two, because there's a problem with the heart itself. And this is where the anxiety lies for a lot of people, because if they feel a very fast heartbeat, they automatically assume it's because of a heart rhythm problem. And although heart rhythm problems do cause the heart to go very fast, in general, they're relatively infrequent. So if you're a betting man, you'd bet that the heart rate is high because of some kind of situation. Let me talk to you about the kind of situations which will make the heart go fast, but the heart itself is only doing what it's being asked to do. So number one, exercise. If you start exercising, your heart will go fast, and you can exercise happily to 220 minus your age and not worry about that. Number two, if you're stressed or anxious, then your heart will go fast, and it can go very fast. Generally, it doesn't go above 220 minus your age if you're stressed, but it does go up. Number three, fever. If you're feverish, if you're generally unwell, your heart has to work harder because the body is asking for more, so the heart rate will go up. Then there are other conditions like thyroid problems. So if you have a problem with your thyroid gland, then you're secreting an excess of a hormone which will make your heart go fast. The heart is not doing anything abnormal here. The heart is just doing what it's being told to do. What else? Stimulants can do it. Anemia can do it. So if you're iron deficient in particular, and the problem with that is that a lot of people, when you are worried about anemia, when you go to your doctor, they check your hemoglobin, okay, and they say, oh, your hemoglobin is within normal limits. But in some people, you can get deficient in iron, and that can be an early sign. So before you actually drop your hemoglobin, you may be deficient in iron. So if your heart is constantly beating fast, it's worth getting these things checked out, getting your thyroid checked out, getting your iron levels checked out, getting your hemoglobin checked out, making sure you're not carrying an infection of some sort. But those are obvious things that could cause it. So those are the sort of things where the heart is actually completely normal. And if you want to treat the fast heart rate, you want to treat the thing that is making the heart go fast. Then there is this group of patients who have actually got a heart rhythm disturbance, and that causes the heart to go fast. So there are a variety of different things that it can be. Number one, sinus tachycardia, which is inappropriate. So the heart rhythm is being produced where it's meant to be produced, i.e. in the sinoatrial node or the pacemaker that God gives us. And that's going, but it's inappropriate. So it's inappropriate because when you have, say, fever or you're anemic, it's appropriate sinus tachycardia because that's what the body is telling it to do. But if you don't have any of those conditions and the heart is going very fast, then that's called inappropriate sinus tachycardia. And for a lot of people, that is we are beginning to see a lot more of this inappropriate sinus tachycardia where there's no good reason for the heart to go fast. The heart rhythm looks normal. And to all intents and purposes, a doctor will look at that and say, well, your heart rate is normal, your heart rhythm is normal. But the question is, why is it going fast? And we can't find any other cause for this. So that's called inappropriate sinus tachycardia. And in those patients, a lot of times what happens is the heart goes up excessively when you change posture and you and I've done a video on inappropriate sinus tachycardia. Then there are other conditions in which the heart can go up. Number one, supraventricular tachycardia. So the heart rhythm here is abnormal. The impulses are not coming from the normal pacemaker, but coming from somewhere else. And this represents an electrical abnormality with the heart. Another condition that can do it is atrial fibrillation, where you have an irregular heart, which is going very fast. Then there are other conditions like ventricular tachycardia, where you're getting impulses from the bottom of the heart, which make the heart go very fast. And for a lot of people, the challenge is to try and work out whether the tachycardia is due to something else like panicking or stress or anxiety, or whether it's due to a heart rhythm disturbance. Now, the easy way to try and work out whether this is the case is firstly to feel your pulse when you feel your heart going fast, okay? A lot of people will feel their pulse in their wrist. I would recommend that you feel your pulse here in your neck because that's closer to the heart, so you will feel it a lot better. Now, how do you feel the pulse in your neck? I have an Adam's apple here, and so if I slide my finger right next to the Adam's apple and push in, I'll feel a pulse. Okay, so the first thing what you want to do if you find that your heart is going very fast is disregard the machine, disregard the app, disregard the Fitbit, stick your finger in here and feel your pulse. Okay, you want to just do one side, you don't want to do both because you could block the arteries and you can get reduction in the blood supply to the brain. So just do one, but feel your pulse. All right, now there's a few things, there's a few tips, all right? The first thing to say is you can calculate your pulse, and it's always good to calculate it manually because that is the most accurate way of knowing what your pulse is. You know, the electrical machine that you've got can malfunction, the electrical machine may not pick up certain beats, and generally the electrical machines pick up this, are strapped around the wrist, and so you're not getting as much of an impulse there, so you can be prone to error. But if you feel it there and you feel it yourself, you will know. I would feel the pulse for about 30 seconds and I'd try and calculate exactly what the rate is. And that is just count for 30 seconds as to how many times the pulse hits your finger, and that will tell you what your heart rate is. In general, heart rhythm disturbances, in general, things like anxiety, panic, etc., will not push your heart rate higher than your maximum predicted, i.e. 220 minus your age. Okay, if your heart is going faster than that for no other reason, then that's more likely to be a heart rhythm disturbance. That's the first thing. So, you know, if it's going at, say, 140 beats per minute, it doesn't mean it isn't a heart rhythm disturbance, but it could also be something like panic or anxiety. If it's going at 240 beats per minute, then it's highly unlikely that that's just due to anxiety or panic, and it makes it a little bit more likely that it could be a heart rhythm disturbance. There's no need to get worried about that, you know, but it just alerts you as to what's going on. Number two, feel for the regularity of the pulse, okay? And generally, supraventricular tachycardias are generally regular. And the only condition that is irregular is atrial fibrillation, which is generally unlikely in younger people, more seen in older people. Supraventricular tachycardias are more seen in younger people. So if you feel the pulse and it is chaotic and irregular, then that is atrial fibrillation. Again, nothing to be too worried about. You know, you have, even if it is atrial fibrillation, there's nothing to panic about. There is no immediate risk. It's always good to go and get checked out, but there's nothing to really panic over. But if you have an irregular fast heartbeat, and that most likely atrial fibrillation. If it's completely regular and it's going very fast, then it could just be sinus tachycardia, which may be appropriate or inappropriate, or it could be a supraventricular tachycardia. In people who have bad heart disease, you worry about things like ventricular tachycardia, but in general, those are rare if you don't have underlying heart disease. And then one of the most important and useful things to understand is that when you have sinus tachycardia, when your heart is responding to something else, the heart rate goes up gradually and comes down gradually. So your heart will be like 70, 75, 80, 85, 100, 110, 120, and then it'll stay 130, 130, 133, 132, 128, and then eventually it'll come down 130, 110, 90, 70. That's how it goes. It goes up slowly and it comes down slowly. Supraventricular tachycardias and most heart rhythm disturbances don't do that. The atrial fibrillation is a bit different, but supraventricular tachycardia in particular, the heart rate is like this: 80, 80, 80, 180, 180, 180, 180, 180, 80, 80, 80. So it goes up, whoomp, like that, like a light switch, stays at one rate, comes down, okay? And that's supraventricular tachycardias. And that is why whenever we're faced with whether something is a true heart rhythm disturbance or whether it's just a normal heart rhythm, because sometimes it can be quite difficult to tell when the heart is going very fast, we always ask for the onset and the offset, because that gives us a really good clue. If it starts off suddenly like a light switch, 90 beats per minute, next beat 180 beats per minute, that is far more likely to be a heart rhythm disturbance. It stays at one level and then bang, it comes out, okay? Generally, most heart rhythm disturbances are not dangerous, okay? Most heart rhythm disturbances, particularly A, if you have a structurally normal heart, 2, if there's no family history of sudden cardiac death at a young age in your family, 3, if you haven't blacked out or feel unwell or have chest pain with it, they're generally not too dangerous. It's always good to go and get checked out, but these tips are really, you know, if you notice them, say, in the gym, and it's really to try and give you something to understand that, well, you know, there's no need to panic. You can be calm about it. And sometimes just being calm and taking deep breaths in and out will help calm them down. It'll help calm sinus rhythm down. It'll help calm inappropriate sinus tachycardia down. It'll help calm appropriate sinus tachycardia down. It'll also help calm heart rhythm disturbances down to a certain extent. So it's always good to remain calm and not panic when this happens. And although it's easy for me to say, I can understand how some people feel, but I hope these tips will help you when it comes to something like that. So if you found this useful, please drop me a line. I'm always really, really grateful for any feedback. I'm grateful for your comments. I would really like this channel to do better than it's doing at the moment. And if you have a little bit of time and you find this useful, please consider sharing it. It then allows me to, it encourages me to continue doing them. So thank you so much. This is my website, yourcardiology.co.uk. My Facebook page, I don't know how I'm known on Facebook, but if you type in yourcardiology@gmail.com, you'll come to my Facebook page. And that's a great place where we can chat if you like. If you have any questions, this is me. And thank you so much. All the best.